What do you think is your greatest asset as being a dentist? Being a good clinician, a good relator, a good business person, a good leader? Probably it's telling stories. Now, when we were in dental and medical school, we were not told stories. We were told facts. We had to regurgitate the facts. They would teach us how many mitochondria there were, and I'd talk about glycolysis, there's a Krebs cycle, and I'm bringing up things that you probably haven't thought about in a long period of time. The electron transport chain. These are all the things that we learned. We learned about bacteriology and pathophysiology and anatomy and how to do clinical procedures, but we were never taught how to tell stories. One of the things that I found in my 40 years of clinical experience, over 40 years actually, is that people don't relate to me if I'm talking to them about facts and figures. I've had a lot of partners and colleagues over the course of the year, and I've watched them talk to patients. And the ones that are most successful, getting patients to say yes to comprehensive treatment, are the ones that tell the best story. Now, when I say telling a story, I don't mean a lie. I mean talking to patients so they can relate to you. As an educator, I very rarely go up and look at a slide and show this fact and this fact and this fact. What I usually try to do is I try to tell a story. Even when I'm talking about biology, I talk about a story about how this cell is going to eat this cell, and this is going to start to lay down bone, and the epithelium will jump over the bone, etc. These are the types of things that I talk about, and people can relate to it because that's how we relate to each other. We don't really relate in facts and figures. We relate by doing something very special. We relate by talking to someone's lizard brain. Now, there are three types of nervous systems. There's the autonomic system, the system that we don't do anything with. It works for us in the background. It's working for me right now. I am not telling my heart to beat. It is beating. I am not telling my lungs to breathe in or to my diaphragm to contract. It's happening automatically. Okay? And it's our autonomic nervous system. Then there's another nervous system. It's the reasonable system. It's the frontal cortex. It's the part of the brain here that all of us humans have that we're able to get facts, regurgitate them. We're able to speak with each other and talk. It's not emotional. It's just looking at various data. And then there's another part of the nervous system, okay, that's in the deep brain. I call it the lizard brain. It involves the hippocampus, the deep nuclei, the amygdala, etc. So our memory is stored. It's the vestigial part of our nervous system. It's the oldest part of our nervous system. It's the nervous system that runs lizards. Lizards don't really think when you hit them or shine a light on them that they're going to do what they're going to do based upon their lizard brain. And that's the part where we can relate to each other. That's the part where you can emotionally get somebody centered. And it's very easy to get people activated and deactivated by talking to their lizard brain. Because we are attracted to stories. We're not attracted to facts. You know, maybe if you're into numbers and you just want to look at, whatever it's called, CNBC or one of those, and you see all the numbers in the stock market. Some people really like to do that. Most of us don't. Most of us like great stories. We don't go to see a movie with a bunch of numbers on it. We go to see a movie where there's a story, and that story sort of gets us, and it gets us emotionally. And if it's a really good movie, you will say something like, "I cried." So when my patients come in, I don't want them to cry, although a lot of them do that. I want them to be able to relate to me, and I want to be able to relate to them. And I do that on a deeper level. I do that by asking them the questions for them to tell me their story. I'm not really interested in where their dentistry was done and how it was done and if they had surgery done or extractions and bone grafts and what failed. But it's important that I do listen to them so they can get their story up because they think it's important. Actually, it's not that important to me. Because as a dentist that's been experienced and been doing this for many years, I could look at a set of x-rays and do a quick examination, pretty much know what that patient has gone through. The mouth tells us the history of where they've been. We all know that. So experienced clinicians can walk in and very quickly can come up with a diagnosis and a treatment plan. Now, when I say quickly, I don't mean in 30 seconds. I mean we have to do our comprehensive examination. But an experienced clinician knows what needs to be done. During that story part of the time where the patient speaks, I will nod. I'll explain to them, yes, I understand that. I can see what you've gone through. I'll relate. I will show them empathy. Because one of the things that is never taught in dental or medical school is the importance of being empathetic. When I'm empathetic to another person, whether it's a patient, a family member, somebody in Starbucks, they can feel it. They can say, this person's listening to me. And not only do I listen to them, I speak to them in parables, in stories. And it will be a story that they can relate to. I was on the phone today and I was doing a meeting, and it was about an area that I didn't know much about. It happened to be social media. And they were telling me about different algorithms and things. And they were talking about this topic and this topic. And I didn't understand a word they were saying, but they were talking. In the middle of it, I said, I want you to talk to me like I'm a 5-year-old and really break it down. And it really changed the dynamic of the conversation because they stopped. And they go, I'm sorry, I thought you understood what I was talking about. We as dentists, we as physicians, we as healthcare providers, we often think that our patients understand what we're talking about. We are speaking in a completely different language. The language that everybody understands is empathy, caring, and storytelling. So where does this take you? If you don't have the ability to tell stories, practice. I've worked with a lot of my colleagues. I worked with one colleague. He actually had periodontal disease, and that's why he became a dentist. I said, well, share it out with patients. He goes, I'm embarrassed. I don't want them to know that. I go, they definitely want to know that. And when that person started sharing the fact that they had periodontal disease, and that's why they were influenced to become a periodontist, guess what? The case acceptance went from 50% up to 80%, literally within a few weeks. I share with every one of my patients the fact that I've had dentistry done. Now, I won't tell them the whole story. I won't tell them about my broken jaw. I won't tell them about my mouth being wired shut. I won't tell them about my full mouth rehabilitation. I won't tell them about going over the bike. If they want to hear the story, I might tell them, but I share very quickly. Patients will say to me, well, it's the worst mouth you've ever seen. I go, no, it's not. Mine is. Now, is that true? No. A lot of my patients have much worse problems than I've had. But when I share that with them, they go, okay, yeah, you can relate. Yes, you want your patients to be able to understand that you can relate to what they're going through. When they feel that, guess what? They feel cared for, heard, loved, connected with. These are all the things that are not taught in school that we have to do if we're going to get patients to be comfortable, go through treatment, and say yes to care. Now, there's a motivational process for this, and it works very well. There's also a selfish process. When patients feel connected to me and they like me, they're going to say yes to treatment more likely than if they don't like me. Matter of fact, if they don't like me, they're never going to say yes to treatment. The best surgeon in the world is not going to have a busy practice if they're not nice to their patients. Now, a lot of people go, they're a really good surgeon, but they're just not that nice, so see them anyway. Nobody wants to see a surgeon that's not nice. And if they feel that you're good and you're nice, guess what? They heal better. And there's plenty of data for that. People who are more relaxed and more calm are less stressed. If they're less stressed, there's going to be less cortisol being secreted, and they're going to be in less pain after. So I always see that people who are happier seem to heal better. It's our goal, it's our role as healthcare providers to make our patients feel as comfortable as possible. And the way to do that is to take off the white coat, not literally, but come off the ivory tower, sit down with them, and talk to them like they're just another human being. I guarantee you'll see the results immediately. It takes some time. It won't happen overnight. It's taken me 40 years. I'm better at it now than I was 10 years ago. And I'm much better at it 10 years ago than I was 20 years before that. But it does work. I've seen it work with time and time again with many of my colleagues. So have a great day, everybody. Tell a great story. And remember to continue to be the gift.